The femur or thigh bone is the longest and the strongest bone of the body. Like any other bone, it has two ends, the upper end and the lower end, and the shaft in between these two ends. To determine the size of the given bone, the upper end bears a rounded head, whereas the lower end is widely expanded to form two large condyles. The head is directed medially and the cylindrical shaft is convex forwards. A ridge is seen on the posterior aspect, which is called as the linea aspera. So the given bone here belongs to the left side. Anatomical position of the femur. The head is directed medially upwards and slightly forwards. The shaft is directed obliquely downwards and medially so that the lower surfaces of the two condyles of the femur lie in the same horizontal plane. Now, to hold the bone in anatomical position, you can keep the lower end of the femur on the table in such a way that the inferior surfaces of both the condyles touch the table. Or this can also be achieved by balancing the neck of the femur on the index finger. So these are the two ways how you can show the anatomical position of the femur. The angle of femoral torsion or angle of anteversion is formed between the transverse axis of the upper end and the lower ends. It is about 15 degrees. We'll see the features and attachments of the femur. We'll begin with the upper end. It includes the head, neck, greater trochanter and lesser trochanter. The junction of neck with the shaft is marked anteriorly by intertrochanteric line and posteriorly by intertrochanteric crest. The head forms more than half of the sphere. It articulates with the hip bone at acetabulum to form the hip joint. Fovea capitis is a roughened pit just below and behind the center of the head. Ligamentum of head of femur or the ligamentum teres is attached at foveae and carries the acetabular branches of obturator and medial circumflex femoral arteries. Neck connects the head with the shaft. It is 5 cm long. It shows two borders, the upper border and the lower border, and two surfaces, the anterior and the posterior surfaces. The upper border meets the shaft near the greater trochanter, whereas the lower border meets the shaft near the lesser trochanter. The anterior surface is completely intracapsular. It meets the shaft at intertrochanteric line. Posterior surface meets the shaft at intertrochanteric crest. Its medial half is intracapsular. The greater trochanter. The lateral aspect of femur continues up as the greater trochanter. It has one border, that is the upper border, and shows three surfaces: the anterior surface, medial surface and the lateral surface. The upper border of greater trochanter is interned, called as the apex. Apex receives the attachment of piriformis muscle. Anterior surface is divided into lateral and medial areas. Lateral area has a ridge for attachment of gluteus minimus muscle. Medial surface is divided into lower and upper parts. Lower part is marked by a depression that is the trochanteric fossa for obturator externus. An upper part is marked by an impression for insertion of obturator internus, superior gemellus and inferior gemellus. The lateral surface presents a ridge which runs downwards and forwards. This ridge is meant for the attachment of gluteus medius. Lesser trochanter. It is a conical projection which is directed medially. It has an apex for attachment of psoas major. Iliacus is attached to its front. Its posterior surface is separated from upper horizontal fibers of adductor magnus by a bursa. Now the intertrochanteric line. It marks the junction of neck and shaft anteriorly. It continues downwards below the lesser trochanter and on the posterior aspect of femur as the spiral line. Capsule of hip joint, iliofemoral ligament, vastus lateralis is attached to its upper end and vastus medialis is attached to its lower end. The intertrochanteric crest. It marks the junction of the neck with the shaft posteriorly. It connects the greater trochanter with the lesser trochanter. Quadrate tubercle. It is a rounded tubercle above the middle of this crest. Quadratus femoris is attached to this tubercle and further downwards up to a line which bisects the lesser trochanter. Now we'll see the shaft of the femur. It is cylindrical in shape, convex forwards and narrowest in the middle. To describe the borders and surfaces of the shaft, it is divided into upper, middle and the lower one-thirds. We'll begin with the middle one-third of the shaft. Middle one-third of the shaft has 3 borders and 3 surfaces. The borders are medial border, lateral border and the posterior border. The posterior border is most prominent. It is also called as the linea aspera. It has the distinct medial and the lateral lips. So the surfaces in the middle one-third are anterior surface, medial surface and the lateral surface. Now we'll see the upper one-third of the shaft. Medial lip of the linea aspera continues upwards as the spiral line. The lateral lip of the linea aspera continues upwards as the gluteal tuberosity. Spiral line and the gluteal tuberosity diverge from each other to enclose a triangular posterior surface. Hence, the upper one-third of the shaft has got 4 borders and 4 surfaces. The borders are medial border, lateral border, the spiral line and the gluteal tuberosity. Surfaces are anterior surface, medial surface, lateral surface and the posterior surface. We'll see the lower one-third now. Medial lip of the linea aspera continues downwards as medial supracondylar line. and the lateral lip of the linea aspera continues downwards as the lateral supracondylar line. The medial and lateral supracondylar lines diverge from each other to enclose a triangular surface called as the popliteal surface. Hence, the lower 1/3 of the shaft has got 4 borders and 4 surfaces. The borders are medial border, lateral border, medial supracondylar line, and the lateral supracondylar line. Surfaces are anterior surface, medial surface, lateral surface, and the popliteal surface. Now we will see the attachments on the shaft. Gastrocnemius muscle. The medial head arises from the popliteal surface just above the medial condyle. Lateral head arises mainly from the lateral condyle, but also extends over the lower end of lateral supracondylar line. Plantaris muscle originates from the lower end of lateral supracondylar line just above the lateral head of gastrocnemius. Vastus intermedius arises from the upper 3/4 of anterior and the lateral surfaces. Articularis genu arises from the lower 1/4 of the anterior surface. Vastus lateralis arises from the upper part of intertrochanteric line anterior and inferior borders of greater trochanter, the lateral lip of gluteal tuberosity, and the upper half of lateral lip of linea aspera. Now the vastus medialis, it arises from the lower part of intertrochanteric line, the spiral line, medial lip of linea aspera, and the upper 1/4 of the medial supracondylar line. Gluteus maximus muscle, its deeper part of the lower half, is inserted into the gluteal tuberosity. Adductor longus is inserted into the middle 1/4 of the medial lip of linea aspera. Pectineus is inserted into a line extending from lesser trochanter to the upper end of linea aspera. Adductor brevis is inserted into a line extending from area lateral to the lower part of pectineus to the upper 1/4 of the middle of the linea aspera. Adductor magnus, it is attached to a line extending from the lower end of quadratus femoris to the adductor tubercle. Specifically, it is attached to the medial margin of gluteal tuberosity, linea aspera to the whole extent, the medial supracondylar line, and the adductor tubercle. Short head of byssus femoris arises from the lateral lip of linea aspera and upper 2/3 of the lateral supracondylar line. Now to summarize the attachments on linea aspera from medial to lateral, vastus medialis is attached throughout its length. Adductor longus is attached in the middle 1/3. Adductor brevis is attached to the upper 1/3. Adductor magnus is attached throughout its whole length. Short head of biceps is attached in the middle part. And the vastus lateralis in the upper half. So these are the attachments of the muscles on the linea aspera. We'll continue with the lower end of the femur. Lower end includes two condyles, that is the medial and the lateral condyle. A deep space between the two condyles posteriorly is the intercondylar fossa or the intercondylar notch, and the articular surfaces, that is the patellar surface and the tibial surface. Medial condyle shows 5 surfaces. Medial surface is the most prominent. The most prominent point on the surface is the medial epicondyle, which is for the medial collateral ligament. Above and behind the medial epicondyle is the adductor tubercle. Another prominence for the ischial fibers of the adductor magnus. Lateral surface forms the medial boundary of the intercondylar fossa. Anterior surface forms the patellar articular surface. Posterior surface articulates with the tibia during full flexion of knee joint. And the inferior surface articulates with the medial condyle of tibia during extension of knee. The lateral condyle also shows 5 surfaces. The lateral surface, an elevation is seen on this surface, which also called as the lateral epicondyle. This is meant for the attachment of fibular collateral ligament of knee joint. Smooth impression above and behind the lateral epicondyle gives origin to lateral head of gastrocnemius. A groove below and behind the lateral epicondyle provides attachment to popliteus in its anterior part. Tendon of popliteus occupies the posterior part of the groove during full flexion at the knee joint. Medial surface forms the lateral boundary of the intercondylar fossa. Anterior surface forms the part of the patellar articular surface. Posterior surface articulates with the lateral condyle of tibia during full flexion at the knee joint. And the inferior surface articulates with the lateral tibial condyle during full extension at the knee. Now the intercondylar fossa, it separates the posterior and the inferior parts of the two condyles. It is limited by patellar articular surface anteriorly and the intercondylar line posteriorly. It is intracapsular and mostly extrasynovial. Anterior cruciate ligament is attached to the posterior part of the medial surface of lateral condyle, and posterior cruciate ligament is attached to the anterior part of the lateral surface of medial condyle. Capsular ligament is attached to the intercondylar line. Now we'll see the capsular attachments of the hip joint and the knee joint. First with the capsule of the hip joint. It is attached to the upper end, anteriorly to the intertrochanteric line and posteriorly to the middle of the neck, so that the medial half of the posterior surface of the neck becomes intracapsular. Now we'll see the capsular attachment of the knee joint in the lower end. Posteriorly, it is attached to the intercondylar line and the articular margins. Laterally and medially to a line 1 cm above the articular margins. Anteriorly, it is deficient for communication between the suprapatellar bursa and the knee joint cavity.